Hello, we are going to be doing our blood transfusion skill, and you'll be only seeing some of my body because everything is here. So let's get started. Okay, so first we are going to check our orders. So I have my MAR orders and my physician orders. So we're just going to be checking them. I also have, I wasn't able to print it out, but I have my patient identifier right here on this picture. So I'll be reading it off that too. So, all right, let's get started. So we're gonna check our physician's orders with our MAR. All right, so here we have Miss Wanda Chi, MRN 87292301, 87292301, date of birth 0920, 19XX, 0920, 19XX, no known allergies. We are gonna check our hematocrit and type and screen stat at 0800, check hematocrit and type and screen stat at 0800. Then we're gonna infuse 2 units, 500 mLs each, PRBCs over 4 hours, infuse at 50 mLs over first 15 minutes. Then we are gonna, so it's 0800, infuse 2 units, 500 mLs each, PRBCs over 4 hours, infuse at 50 ml over first 15 minutes. Then we have monitor vital signs per hospital protocol at 0800. Monitor vital signs per hospital protocol at 0800. Got it. So we did that. So the reason we're going to infuse it at 50 mLs over the first 15 minutes is because we just want to make sure that the patient is not having a reaction to the blood. So giving it at that slow pace, we'll be able to see if the patient has any reactions. And you're going to be in the room for the first 15 minutes giving blood, so you'll be there. Okay, so now we're just gonna look at our blood work. We have our lab values here. Our hemoglobin and hematocrit is low, so that's where we're gonna be doing the blood transfusion. And yeah, so we're gonna look. So now we see that our patient is O positive blood type. That patient will be only able to get O positive or O negative. Can't get anything else but that, or the patient will die. So now we're gonna look for the consent. The patient will be getting the blood for anemia, and I have it over here. Yes, so that is why the patient will be getting blood. And so the consent has to be signed. If it is not signed, it is not good to go. So consent has to be signed, and read over it, why the patient is getting it, make sure the lab values add up, so that's important. So now that I've checked everything, I'm gonna make sure that I have normal saline, and that's not gonna be on the MAR, but it is the only thing safe to run with blood. So normal saline or sodium, yeah. So perfect. So now that we do that, we're gonna just gather our supplies and make sure all the expiration dates are good. We're gonna have our Y tube for blood solution set, alcohol pads, our blood transfusion record, gloves, flush, blood, normal saline. Everything's good, expiration dates checked, everything is good to go. Now we're gonna go to the patient room. Okay, so knock, knock, knock. Hi, my name is Emily. I'm going to be your your nurse today. Can you tell me your name and date of birth? Hi, my name is Wanda Chi. My date of birth is 0920, 19XX. Perfect. Any allergies? Patient states no allergies. Okay, perfect. So I'm going to be, then now I'm going to just tell the patient what I'm going to do and why. So today we're going to be giving you a blood transfusion because your hemoglobin and hematocrit levels are low. And I'm going to be here the first 15 minutes if you have any questions, just to make sure that the blood is going in your body correctly and you have no side effects, because we want to make sure that the patient is not reacting bad. So I'm going to do that. And we're going to be watching for any rash, chills, temperature, itching, swelling, anything of that. So that's what we're going to watch for. So I'll ask the patient if they have any questions or concerns. Patient states no. Perfect. So I'll tell her what to report like I just stated. So we're gonna get our vitals 3 times during this skill. So first, when you enter the room, second after 15 minutes of the blood, and then the third vitals is when you complete the blood transfusion. So we're gonna get our first set of vitals. Vitals look good and stable, so we are good with the first set of vitals. And we're gonna check our IV patency. So here we have our IV. We're gonna check the patency of it. So we're just gonna make sure that it's not blocking and it like receives the flush good and that it's not swelling up. So we're then, oh sorry, I had a sore throat. And then we're just gonna make sure to clean the site. Okay, so I'm gonna just don my gloves. I'm gonna wash my hands. Okay. Okay. Wash my hands, don my gloves. Make sure the patency is good. Make sure the tips are sterile. We're just gonna clean it off. You know, clean. Okay. Very flush. You can put like 2 mLs of blood in there. Make sure tips are staying sterile. Okay, so make sure it is unclamped. You're pushing 2 mLs. Perfect. There is no resistance. Patency of the IV is good. We're good to go. So we're just gonna clamp it back. Okay, perfect. So that is good. Make sure the tip stays sterile. You want that. All right, so we got the bubble out of the flush. We flushed to check for the patency. IV is good to go. So that's very important. Now we are just going to check the expiration dates on everything again. They're all good to go. I checked them in the beginning. So for the blood component, we're gonna get our blood component and we're gonna make sure the 2 nurses are here to verify it. We'll be checking the armband and the transfusion record number and making sure that there's no leaks or clots. So here we have the transfusion record, record number. So we're gonna be checking that. Okay, so we're gonna have 1 nurse reading the transfusion record and I'm verifying with the patient armband. So we're gonna make sure that the transfusion record number and the patient's ID band match. And we're gonna do this at the bedside. So I'm gonna take these off and I'm gonna perform hand hygiene and I'm just going to make sure it checks off, everything checks off. And yeah, so we have the transfusion record number is 01234567889. Okay, and 01234567889, perfect. And I'll be checking it with the wristband as well. And what is it? I only have the O positive blood. I don't have the AB negative. So I just want to let y'all know that's the only one I have. So I'm just going to be going by what I have. And if it was incorrect, I would make sure I got the right type of blood, because if we give the wrong kind of blood, the patient will die. So I don't know if I'm going to be counted off for this, but I'm going to be giving O positive like I stated before. The armband says AB negative, but yes, I know what to do if the blood was wrong. So I would just, you know, say that that blood is wrong and I would ask for the right one. But, you know, we're just going to say I have the patient is O positive. So we're going to make sure that the patient's ID matches and stuff. We have the unit number 0067977, 0067977. Okay, the date of birth, everything matches. Then we have that we did the transfusion record number, expiration date, XXX 2020. I'm gonna make sure that matches too, so it matches. Everything's good. We checked the patient armband too. And yes, unit number is correct. Okay, the unit number is correct. Okay, perfect. So everything matches. You got to make sure everything matches. And because this is an old bag of blood, I didn't get the new one, that's why. But yeah, so I know what to do. Okay, please don't fail me. Okay, so we're gonna make sure everything's good. We're gonna wash our hands and now put on our gloves again. So we did hand hygiene and we're gonna prime our tubing. Okay, so we're just gonna take this out. Okay, we're gonna prime our tubing. Okay. All right. Okay, so we're gonna make sure all the clamps are closed. That's important. Okay. All right, so now we made sure that everything was checked off and everything matches. We had 2 nurses do that, and I did that because I have to verify it too, because any mistakes made, it can result in death. So after that, we're gonna make sure all the clamps are closed. There's gonna be 3 clamps, so make sure the tips stay sterile. You don't want the tips touching anything dirty, so we're just gonna make sure that happens. And we're gonna do the normal saline first. So we're gonna make sure we just get this in order, because, yeah. Okay. Go away. Okay. Tips are sterile. Okay. Everything is locked. There's 3 clamps. So 1, 2, and 3, and then there's this little blue one. Okay, so we're gonna start with our normal saline. We're just gonna pop it. Gonna get one of them, and make sure you just go straight down, no holes. Make sure you just do it straight down. Don't poke any holes. Okay, so there we go. That's our saline, and then we're gonna be hanging the normal saline, and we're just gonna, I'm gonna unclamp it, give it a little squeeze. Okay. Okay, make sure the ball is like slightly floating. Let's give it a little squeeze. Okay. And then now we're gonna just unclamp the bottom to let it float at the tip. Okay, there we go. Okay, all right, there it is. Okay, it's at the tip. Check for bubbles, no air bubbles. Perfect. Okay, there we go. Okay, ball is slightly floating. Perfect. I don't know if you could see that. There it is. Okay, so we let it get to the tip. There's no air bubbles. It's perfect. Now we're just gonna make sure to clamp all that back up. Okay. Okay, so there we go. The tubing is primed with the normal saline. Then we're gonna grab the blood. Okay, that tubing is primed. Okay, so just imagine I'm hanging it up. I just don't have anywhere to hang it. Okay, so now we're gonna do the blood. Okay. All right. So now, make sure you don't drop any of the blood. And just put it right in. Make sure not to poke any holes, because now we're gonna prime the blood. Okay, perfect. All right, so that the NS is clamped. And we made sure that there was no clots and the blood looked good. So we spiked the blood bag, and the normal saline is clamped, and the second clamp is 2. So now, we did this, and now we're gonna hang it on the other pole. So we're just gonna, okay, sorry, it's gonna look like this. Okay, there's no air bubbles or anything. So now we're just gonna unclamp, get it a few squeezes. You're gonna notice it's pink. Okay. So we're not going to waste any blood. The fluid will turn pink, so we're going to let it close to the tip. Okay. So now, I'm going to let it get, there we go. Okay. Perfect. So it's going to turn pink, and we let it get to the tip. We don't want to waste any blood because you don't want the patient. So we're going to let it get as close to the tip as we can, the closest, because you don't want the patient to be getting, you want the patient to be getting blood, not normal saline for 15 minutes, because it's not going to count. So we clamped off the tubing, everything is ready. We're going to connect the tubing to the patient's IV. So as the normal saline was running, we're going to remove the saline, make sure it's clamped when you remove it, and then we're just going to, so after that, okay, sorry, I messed up a little. The normal saline, we cleaned the tip, alcohol, okay, sorry, I'm a little nervous. Okay, so the saline was running, so now we clamp the saline, and we're gonna let the blood transfuse, okay? So we connected it to the patient's IV, we removed the saline, we make sure it's clamped. Everything is sterile, okay? So I know it may not look in order and everything, but everything is sterile. Okay, so we're just, we're good, and we're just gonna open the, we're gonna open the tubing clamp and just regulate blood flow properly. So that is good. No NS is running right now. It's the blood. So we're gonna program the pump at 50 mLs an hour for the first 15 minutes. So we're gonna unclamp the second clump of the blood, and I'm not gonna do it because it's gonna spill everywhere, but you would unclamp the second clamp of the blood. Make sure that the normal saline clamp remains closed or clamped. We're gonna stay at the bedside, monitor the patient. After 15 minutes, we're gonna get our second set of vitals and make sure, so we're stating that the vitals are good. We don't see any of the reactions like chills, temperature, rash, anything, swelling or anything. So making sure that the patient doesn't have those reactions, we're still good. So now that the blood has transfused, we want to make sure that the blood runs within 4 hours, nothing longer than 4 hours. Then we're gonna change the setting to 125 mLs an hour after those 15 minutes. So the pump is programmed, blood's infused, completed. We clamp the blood, make sure everything is clamped. So that's perfect. Make sure everything is clamped, blood was transfused successfully. So now we're gonna just flush with saline. Okay. So there's my saline. We're just gonna clean it off with the alcohol and flush 2 mLs. Make sure all the blood is getting in there. We want all the blood in there. Okay, so now we're gonna make sure that our IV is unclamped when we do all of that. So that's perfect. So all the blood is in, and yes, so we're gonna just make sure it's flushed. It's flushed. Okay, we take it off, and now we get our third set of vitals when it's done. When all the blood's transfused, we get our third set of vitals, and make sure your blood is disconnected and all the clamps are closed, including the IV one, when you're done and you had flushed it. So now we're just gonna dispose of everything properly wherever it's supposed to go. After that was transfused correctly, then we're just gonna dispose of that. We're gonna make sure we remove our gloves. We perform hand hygiene. We check on the patient. We put the belongings close to the patient. Bed alarm is on, call light is on, bed in low position. Let the patient know if they feel any of those side effects to please call us, and that we'll be back anyway to check on them. And hand hygiene again, and that we're gonna document everything that we just did. The blood type, how the patient took it, if the patient felt anything and the patient did not. So that is just what we do. We document everything. We made sure that we had nurses verify too. We verbalized our reactions, any temperature, phlebitis, rash, short of breath, tachycardic. We verified that we had our consent, and that made sure our blood was compatible with the patient. So that's good. So we are done. And thank you so much. That is my skill.